I don't think it will come as a surprise to anyone to know that people are aging and living longer with a lot more chronic health conditions. I'm Dr. Emma Limas, and I'm a recent graduate of the Ottawa PGY3 program in care of the elderly. I'm currently working as a care of the elderly physician at the Bruyère Geriatric Rehab. Really, the third-year program in care of the elderly helps to prepare you to serve that specific population. The third-year program will allow you to either bring that knowledge back to your own family medicine practice and apply it to your own older adult population, and or act as a consulting resource for your family medicine colleagues in the community. I'm biased, but I think we have a pretty great group of care of the elderly physicians here. So certainly this is a program where you'll be very well supported by your colleagues, many of whom have done this program at some point in their career. Doing the third year program gave me a chance to work on developing some of those more specific communication skills that apply to both care of the elderly but also to family medicine in general. So how to talk to patients that have cognitive impairment or sensory impairment, but also how to navigate communication with families and conflict within families and things like that. I definitely feel more ready to approach those situations if and when they arise in my practice. By doing things in rotations longer than one block, I found you really get a chance to get a good depth of knowledge, get really comfortable with the material, get comfortable with the patient population, and the different environments that you're working in. So a lot of the different rotations in the third year program are based out of the Elizabeth Bruyère Hospital, but also in some peripheral sites and the Ottawa Civic Hospital as well. In the role as a third year, more senior resident, you also have a lot of opportunity to do teaching with your other resident colleagues, including medical students as well. We're also able to present at academic rounds with the geriatric medicine team. So there's definitely a lot of opportunities for teaching, presenting, academics, that sort of thing. In Ottawa, there's a very diverse, multicultural, multilingual community. And in terms of languages, there's also lots of opportunities to pursue at least some of the third year program in French if that appeals to you. I really love living in Ottawa. I've lived in bigger cities before and wasn't really sure what to expect in the kind of medium-sized city of Ottawa. But I really think you kind of get the best of both worlds. I still bike to work every day, and I get to go bike along the canal. I can do lots of stuff outdoors, but the city itself, I think, is also just a really welcoming place and really great place to live. If you really have any interest in care of the elderly, I would encourage you to go for it. It's a great program. You'll meet lots of great people and lots of great experiences, but even if you don't work as solely care of the elderly based practice, it's knowledge that will be a great resource to you as a family physician.